Hi, good afternoon, everybody. We've got another Friday live session. I'm particularly interested in this one because I think it's really quite revolutionary in terms of innovation in the public sector, because we're talking about crowdfunding to really change things. So it's going to be a really exciting session, I'm really convinced. So as always, these sessions are about trying to be proactive and positive and showcase solutions to things as opposed to us just being a moaning shop. So that's what we're trying to do most weeks that we do these things. And today I'm really delighted that Rebecca's going to be leading this, and it's driven by her business, Shiny Mind, and we'll talk through all this in a lot more detail as we go through the hour session. So we'll do a quick first 60-second round robin introductions for us all, and then we'll get into the detail and we'll go through to the discussions. As always, I really encourage people in the audience to put comments in and points and questions, and we will pull them up onto the screen and discuss them as we go. So I'll start off then. My name's Anthony Lawton. I'm all about driving productivity and change and improving health and well-being in the workforce within the public services. Focused on the NHS because that's where most of my history and my work's been, but I'm really interested in supporting councils and schools, which I'm doing more work with, which is great. So that's me. I will hand over to Janet next, if that's okay.
Yes, thank you very much, Anthony. Lovely to be here. So I'm a nurse and I am a strategic primary care nurse, and I work in Bedford, Luton and Milton Keynes. So a lot of my work is around recruitment, retention, but I also have a remit for wellbeing of the workforce, and I'm also an advanced clinical practitioner, so I do work clinically as well.
Fabulous. And Sian?
So I'm Sian Stanley. I'm a GP first and foremost in Bishop Stortford. And I'm a partner in my practice. My role today is as my clinical director role for Stork Valley and the Villages Primary Care Network. We set up a service which we've won an award for about neurodiversity and waiting well pathways for people with ASD and ADHD.
Brilliant. And then over to Rebecca.
Lovely to see everybody here. I am Beck Howard. I'm a clinical psychotherapist. I'm the CEO and founder of Shiny Mind, and we're passionate about using psychotherapy in a preventative, proactive way, going upstream to support patients, to empower them, as well as people in the workforce to improve their mental health and their physical health.
Fantastic. We're just waiting on potentially one more member, but not here yet. So I'll just let them in as and when they turn up, if hopefully they can. So do you want to share your slides now then, Rebecca?
Yep, I will do.
Okay. Great.
So today we're excited to meet all of you guys to actually launch something that's perhaps not happened before, crowdfunding for healthcare innovation. And today we're going to be using crowdfunding to tackle the issues surrounding adult neurodiversity. And the idea is, if we want things to change, perhaps we need to step forward and be the change that we want to see happen around us. Every day, thousands and thousands, if not tens of thousands of patients are stuck on waiting lists, waiting for support, waiting for a diagnosis, not feeling validated, and without treatment. In terms of adult neurodiversity, there are very few options other than medication. And so that means that actually patients are forced to actually go and look for other support. And unfortunately, a lot of them will go and actually access support like TikTok and podcasts from influencers who are nothing there is evidence-based or clinically validated. The impact on people without the right support is that their relationships suffer, their work suffers, their families suffer, and actually our demand in the system gets higher and higher, the pressure increases, and the cost to the system increase as well. There has to be a better way. And today, hopefully, we can actually do something about that. Nobody is waiting well. Nobody. And what could happen if we just imagine for a moment, what would happen if we could come together as primary care clinicians or other people on this call who've got an interest in this, in supporting people in their workforce with neurodiversity is that we could actually create a solution that actually would help patients, support them from a time when they are needing support in the GP surgery whilst they wait and beyond. We've done this with NHS England's Joint Clinical Reference Group when we co-created the Menopause Life Pack. In fact, that's how I met Anthony. And today we're advocating that we can do this again and bring a similar approach to crowdfund an adult neurodiversity life pack, delivering significant ROI. So just imagine what would change for you, your patients, and even if you are on this call today and you are an adult with neurodiversity, how things would have been different for you if you'd have been supported. A lot of you out there might not know what Nurse Shiny Mind is, so here's a few bits of information to help you understand. Shiny Mind is an interactive digital mental health app. It was co-created with the NHS clinicians, and it is used by them still to actually support them in terms of their mental health. But they saw that it could actually support patients, and they led clinical-led trials to support patients with anxiety and depression. Because of that clinical advocacy, the activation rate in patients picking up this to start working on their mental health and improve their anxiety levels or their low mood is 67%. What happens for a patient is that they get access to what's now known as a digital patient wellbeing prescription, but they also get their prescription bespoke to their needs. So we build and can build condition-specific life packs co-designed with the NHS. We have coping with anxiety, mental wellness, and as I mentioned before, we co-designed the Menopause Life Pack with NHS England's Joint Clinical Reference Group. Clinicians are also able to support their patients outside of one-to-one care with psychological behavioural nudges to support patient activation and improve both mental and physical health. We can do this individually and at scale to thousands of patients at a time. And this is an example of the resource we built with the menopause team. But what's the impact? Here is some of the impact that we are seeing in patients who use Shiny Mind. And I'll just click through these. We've also utilised Shiny Mind to support patients on the waiting list for talking therapies. And we can see, coupled with the prescription and the life packs, that people use fewer talking therapy sessions to get to reliable improvement. There is also no health without mental health. If our mental health is poor, we don't connect well, we don't eat well, we don't adhere to our medication, we don't move, and we don't sleep. And we can see very quickly, longitudinally, those patients supported by Shiny Mind also start to see improvements in their physical health also. There is a time and a place where maybe we need to look at things differently. Instead of waiting for other people to solve the problems that we are all sat with, perhaps we can start to look at what we can change ourselves. So today we are launching our crowdfunding approach to building an adult neurodiversity life pack. We want to do this with the right people in the room because my firm belief is if you want a really robust solution, you gather the people and the knowledge into one room and you let them, those people with those problems, find the solution and design it. So these are examples of the people that we want to talk to create what we're calling a clinical senate. But first and foremost, patients with lived experience need to be in that room to tell us how they feel, how things have been for them, what's not working and what does work. And here is also a suggested outline of some of the things that those practitioners and clinicians and patients are already telling us they need that aren't out there, which means that they can actually start their recovery journey and improve and actually get back to empowering themselves around their condition that they can find anywhere else other than TikTok. To be part of this change, we've created some crowdfunding packages. Our goal to actually make this happen is 95,000. That is based on the work we did in a similar pathway, which was with the menopause team. We want to get this up and running by the 31st of May. The minimum to get started is 50K. We know that everybody in this room isn't sat with £50,000 in their budget. Wouldn't that be lovely if you did? But what we are looking for is for people to come together to actually just put a little bit in of the funding. So together we can make this happen. You can join us for as little as £1,000. And if you're too busy to co-design, it doesn't matter. We can still support your patients, 100 of them, at a discounted package. But if you did have time and you were really passionate about making this happen, we would love to talk to you. And there is another package here. So we have a QR code, and the QR code is here for you to scan to get involved in this pioneering crowdfunding initiative. Because just imagine what would happen if we did this. By the end of 2025, every one of you listening today would be able to get involved and access this to support their patients. So that if we get the right people in the room, we'll be able to support thousands and thousands and tens of thousands of patients. Patients who are desperate, in need of support, and turning up at GP practices or not turning up at work because they are struggling. This will reduce demand, it will reduce costs, and it will reduce waiting lists. And we will have created a completely new way of creating innovation in healthcare, because this is a way to tackle waiting lists. Rather than waiting for somebody else to solve this problem, I believe we can actually do this together. And then we can apply it to other areas such as living with pain, or to support those families who are so struggling because their kids are on long CAMHS waits. We are only limited by our ambition and our want to collaborate. I so hope that you come on this journey with us to get to the amount we need to make this happen. There's about 200 people on this call. We only need about 30 of you. Please share this with your colleagues and your wider network. And I am so looking forward to being part of this conversation and welcoming our panel to talk about the wider issues here. Thank you.
Wow, that's a brilliant presentation. Fantastic. I think it's a brilliant idea, Rebecca. I really, really do. I had a similar experience in 2012 when the PCTs were restructuring. I was working for Manchester PCT, and I was just seeing the chaos and the lack of management, proper management of people, and understanding the best people to go to the best places, whether it's through to the council or whether it's to a CCG, and it was chaos. So I did something similar. I got a budget for £50,000 to build a platform to manage that whole process for us, and each of the 10 PCTs put in 5,000. Because it was such a manageable number, they all just said, okay, here you go. We could get it built. It was all done, and it worked really well. So I'm really excited about this initiative. I think it's a genius idea. Brilliant. Shall I hand over to Janet and we'll go that way?
Yeah, no, that would be great.
Yes, well, I've been working with Beck now since probably 2019 when I was Deputy Clinical Director of my PCN. And that's when I first met Beck and did some work with her. And that's when I first had the app. When at that point, it was only NHS, people working in the NHS that had access to the app. So I've been using it quite a while. And as I said, I was working clinically as well at the time. And I remember I had a patient come in to see me who asked for some antidepressants and 3 months off work because she was having some work-related stress. And the more she told me about the reasons why she was feeling so stressed, undeniably her life was miserable and she was having a lot of physical manifestations. But when I really listened to the story, it was more of a social problem due to maybe poor line management, an overwhelming workload, and not being able to do the pushing back. And so I thought, at one point, I'm listening to the drama triangle here. So I picked up the phone after I'd spoken to the patient and dealt with everything. And I said, could we maybe try the app with a patient? And so I brought the patient back in. I gave her the option. And because I knew the app so well, because I used it, I was able to say, have a go with absolutely everything. But I'd like you really listen to the drama triangle, listen to the mindset, listen to some specific masterclasses. And we had already negotiated the medical certificate and maybe some medication, and I'd referred her to IAP. And she came to see me 3 weeks later saying, well, I didn't need the sick note. I'm going back to work. I needed to have a really robust conversation with the people that I'm working with. And I know that now. And she loved it. So we thought we were onto something. And that's how we did more work in BLMK with Beck. So we'd already, as a wellbeing lead for the ICB, we'd already bought licenses. So there were hundreds and hundreds of people, my colleagues over primary care, using the app for themselves to alleviate day-to-day stress and the pebbles in our shoe that trip us up in life. And we were having lots of positive conversations. Then we started to invite colleagues to work with Beck and I. So not only did they understand the app more, they were able to do that wellbeing prescription for the patient. We could really personalize it. And Beck and her team have developed the most amazing app on the desktop. So it can take us under a minute and a half to prescribe this for patients. It's brilliant. So what we were finding is it was working really well for the workforce personally. The patients were really benefiting. They were loving this different approach to their health and well-being and their mental illnesses. And the workforce were feeling more productive, because I don't know about the clinicians out there. Of course, we refer patients to talking therapies, but it's a long wait. So what do we do for patients while they're waiting? So the workforce was feeling better about the work they were doing, because actually we're helping patients to wait well. And then we have extrapolated this. So not only are we helping the workforce, we're helping our patients. And so now we are at a point where we want to add more specific life packs, and that's where we come with the neurodiversity life packs. Because again, when adults come to see us, they're looking for an assessment, they're looking for support. We have families that are splintering because they have difficulties and challenges in their lives, but there isn't really anywhere to go apart from a long wait. And that's why I think the impact of a neurodiversity life pack would be so brilliant, to help the patients that we want to support, but the families that are surrounding them that are desperate. Often I'll hear the families saying, we really want to help our son, our brother, whoever. I don't really know what to do for the best. I don't know what are the right words. How am I supposed to approach this? So people are desperate to help each other. They don't know how to go about it. And that's why having this app in the pocket when we know every other aspect of the app is so useful. And that's why the crowdfunding approach, I think, could be really good, because it's like the hive mind, really, isn't it? All the people, the right people in the room, coming together, having an idea about what we may want to do and what is the best thing to put into this life pack, as well as the patients with the lived experience. I think it could be absolutely sensational, groundbreaking, and really inspirational for all of those residents that we are trying to help. And I think the app is just brilliant. I've been using it for 6 years. Many of my colleagues have, and the patients absolutely love it and can find a real benefit in it.
Brilliant. For me, when you mentioned it in the slides, Beck, the key is that having that robust, trustworthy data, isn't it, and information. So we can all go and Google things or ChatGPT things, but actually having that robust, really thought through, evidence-based data is absolutely the key.
I absolutely couldn't agree more, and I think that we're not doing the best that we can if that is the only route that patients are feeling like they have to go down, is to go onto TikTok and get whatever is given to them. I just think we can do better together. We can do so much better. So I think lived experience in terms of getting this resource created is fundamental. We could not do this without having patients in the room.
Yeah, brilliant. And maybe we can catch up on Insight Genie could help you with your research as well. That's for another meeting. I'll just raise this. This has been put into the chat in the event, so anybody can find this at any time. Just going back to the event and finding this link. So if this does sound interesting for your organisation, your PCN, then please do click on that link. I'll bring this up later on as well. Is now a good time to introduce Leslie? Rebecca, or have you got a different?
No, I think it's a brilliant time to introduce Leslie. Thank you so much, Leslie, for coming to chat about your experiences and your thoughts on what we're doing.
Yeah, so Beck I've known Beck for a while, because I'm a freelance consultant working in health tech, digital health. But I spoke to Beck. Probably I don't often disclose that I've got ADHD, mainly because I was late diagnosed. So I was in my late 40s when I was diagnosed, accelerated by perimenopause and COVID. And I'd sort of figured out that I probably would be diagnosed with ADHD because I wrote back in 2016 an adult ADHD proposal to, I think it was the Primary Care Trust back then. It was CCG back then. And I had to do the research and I did a little test and I thought, gosh, I'm coming up quite high. And then I forgot about it. And then when I was in my late 40s, I couldn't mask anymore. It was getting quite ridiculous. Lots of symptoms coming up that were really affecting my work, my productivity, and just executive functioning. So I'll just explain a little bit about my journey because I think it's sort of quite useful in this context of where technology can help. So when I was diagnosed, I paid for my diagnosis privately. Then I knew that I wanted to get medication. So I had an NHS diagnosis. And then I was put onto quite a long waiting list for titration to get my medication. And during that time, I thought, okay, what are you going to provide to me? Absolutely nothing. There was nothing. I was only going to get any kind of treatment or care through the NHS. It was medication or nothing. I didn't need any support from a mental health trust because I don't have a history of anxiety or depression. So it was kind of left to me to sort of figure it out. The private psychiatrist sort of said, read this book. That was fine. I got a lot of information off TikTok and podcasts, to be honest. But what I didn't get, I got a lot about reassuring me that I wasn't rubbish like I'd been told for 40 odd years. And so I found an ADHD coach and paid for it I paid for them privately, first of all, until I got an access to work grant. But during that time I was on that titration waiting list, what would have been useful for me, what I've got out of my ADHD coach, but also from a clinical perspective, is just the strategies and tools that I need to be able to manage my ADHD symptoms for my everyday work life and personal life. And there is no information out there. It's very difficult to find clinically evidence-based. I mean, the NICE guidance just says have CBT, I think, which is not available. Sort of seems to be a postcode lottery. But there's something about the learning around my ADHD and how my brain works, the neuroscience behind it was incredibly useful because then I understand from a clinical point of view, I'm not clinical, but how my brain works. But also we worked through some of those strategies to help me with my executive functioning, my impulsivity. I'm a terrible spender. I'm terrible with food. I'm terrible with alcohol. So we went through a lot of those strategies. The also distractibility. So medication is very good for controlling my getting distracted and moving between tasks and not finishing projects. Doesn't solve things like impulsivity, rejection sensitivity I have as well. So I honestly always thought that other people felt rejection like I did, quite a physical pain. I honestly thought I was just being oversensitive. But the sort of strategies that I've learned how to deal with that, my emotional dysregulation, understanding about my impulses. So I don't go and buy another pair of shoes. I don't overspend. I don't build up my credit card. Also understanding, I don't know if you've come across the phrase ADHD tax. So parking fines, lots and lots of parking fines I get, speeding fines, late payments, credit card, interest. But working through with my coach, I've learned the strategies and the tools and most importantly, triggers and how to maintain a lifestyle that means I can manage my symptoms. So when I talk about lifestyle, exercising regularly, which I unfortunately do, but the exercise, eating properly, getting enough sleep, not having people in my life that affect my emotional dysregulation as well. So for me, an app that can help me learn about my ADHD, be able to discover my strategies, tools that can work, And also, most importantly, what I've never got from technology is the proper nudges. So I need constant reminders, but it has to be a very intuitive, balanced nudge. So if I get too many nudges, it just goes, it's going over my head. I don't see it. So I know with Shiny Mind, with the nudges, and they can get tailored, that would work. I know that would work for me. I need to be reminded to take my meds. I need to be reminded to eat and go to sleep. But I also need the nudges when I know that I'm slipping with some of my symptoms and the impact. So particularly around my executive functioning, my meetings, going to them at the right time, right place, not being late, not being too early, not stressing about it's all of those symptoms. If I've got something that can help me, and I can see that when people are on, my brother's been on a waiting list for titration, probably for about 3 years, I think now, in Surrey. If anyone's on from Surrey, please sort it out. But he needs something. I have said to him multiple times, you need to get an ADHD coach. He's waiting for his medication, but anything that would be able to help him. He's learned a lot, again, probably not clinically validated, of podcasts and online, etc., to sort of understand about his condition. But as he's sort of reported back to me, there's nothing about strategies either. And the other part, I just sort of say, I've tried to fix and use the technology that's out there to help me with my ADHD management, and I've not found anything. What I have done recently is used all the notes from my ADHD coaching sessions. I've put them into ChatGPT, and I'm using ChatGPT as my coach at the moment because I've run out of access to work funding. So I don't think that's going to work because it's not sophisticated enough, but that's the sort of approach that's the only technology that's out there. So if there's anything that would help people, the understanding and the management and the tailored approach, and it's just having someone to be able to go back and forth as well, that would be enormously helpful. I hope that helps. I hope that sort of comes with it. I've never done a sort of patient perspective. I've listened to lots of patients in the past and done patient engagement. I've never been the patient with lived experience sort of explaining it.
If there's ever an advert for the importance of getting close to the work and speaking directly to patients, you've just done an amazing job.
Thank
You
you.
really do get a sense of why we need to be doing this work and how important it is. Amazing. I'll hand back to you, Beck.
Well, a big thank you, Leslie, because it takes a lot of bravery, honesty, and being courage and being vulnerable to share your story, and I really, really appreciate it. And that is why I am so passionate about us doing this well, because it's not good enough that patients are stuck or waiting for a diagnosis and can't start a journey that helps them understand themselves.
And I also think if you're looking at it from an NHS perspective, the diagnosis will get you medication. You don't necessarily need the diagnosis to be able to manage your symptoms. So the diagnosis is just the end. The only reason I got the diagnosis was to get the medication, which sounds quite blunt. There's a lot of people that don't want the medication. They don't want it. They don't want the flat. It does. You do get a flatness with it. So I think anything, if you've got people on the waiting list, they may not need that expensive diagnosis and assessment. If they learn about it and they can learn those strategies, I think that's going to also generate those savings, because once you have figured out that the medication helps, it's an expensive route for the NHS as well. There's, looking at cost savings. So I do think there's something about giving people those strategies and tools so that they can just manage it without medication, and they can just manage themselves better. It's a lot better self-management.
Absolutely. I couldn't agree with you more. Maybe, Anthony, should we bring Sian in?
Yeah, great idea. And then I'll put my finance hat on and just drill into the mechanics of it, if that's all right.
Yes, absolutely.
Well, actually, it nicely follows on from what Leslie's been saying. So, Leslie, I'm Sian. I'm a GP, but I also run a Well, it started off as a children and young people's social prescribing service, and over the time it's evolved into all sorts of different little branches of it. But one of the main branches is a neurodiversity pathway that we set up at a primary care network level. So patients are referred to us via their GPs within the PCN. So we have 5 practices, and part of our team is an occupational therapist. We have a children and young people social prescriber, and we have a mental health coach, and me, and I'm the kind of supervising GP for it all. So the service is divided into sort of a game of 2 halves. We have the children and young people's type service that goes on, and children's neurodiversity. But what we're increasingly seeing is adults who are worried about ADHD as part of their diagnosis. But our local trust has actually closed its list to anybody being referred for adult ADHD now. So that just shows you, and even then the wait is 4 years. What's interesting about that is you can refer if you can demonstrate serious lifestyle issues as a result of ADHD. Not sure what that means. None of us have really got to the bottom of what those sort of nebulous things, but it's kind of driven a desire to go through things like right to choose, which I think have become quite open to diagnostics. So we lots of people are going and then getting the diagnosis, but then what? And in terms of medication, it's very difficult. Any GP at the moment will tell you that going into shared care agreements and shared care arrangements is really complicated. It's okay if people have had an NHS diagnosis, that there's clear pathways for that. We work kind of nicely together. But once you start getting somebody who's had a right to choose diagnosis, and then they come back into primary care, and we're not set up for it, and it's all sorts of different ramifications. And a lot about that is about monitoring the medication safely and making sure that people are taking them appropriately. So one of the things that we decided to do was that really focus in on the non-medical intervention. So it fits really, really well with Becca's work, because what we're saying is that there's a lot of evidence for occupational therapy in neurodiversity, both for ASD and ADHD, and about sort of emotional regulation, and about how a lot of what your coach probably did with you, Leslie, is possibly some of the techniques that ROTs are using. And we also have a mental health worker who can highlight those patients who really, really do need the medication and really do need that. But like you said, it's not for everybody. And I think adults with ADHD can present slightly differently. When you're in the education system and you're in a very rigid framework, I think ADHD is a very, very difficult thing to sort of cope with, because you're being educated in a very particular way, which may not suit the way you want to learn, the way you're not in the mood for that. I've often thought that some people, if they're just in the mood for history, they should be allowed to go and do history. If they're in the mood for maths, can go do maths, and that's very kind of part and parcel of ADHD thinking. And I think once people have got into the workplace and they're able to be a bit more free, as it were, of those rigid structures, some people find their ADHD their superpower, their productivity, the way they like the feeling, like you said, that that sort of the dopamine kicks that can kick in. And I think that each individual will need something sort of different, and this is where this type of app is really useful, because of course people can pick it up when they're in the mood. You're not saying, right, on a Tuesday afternoon at 3 o'clock you are now going to be having some coaching, which you may or may not be in the mood for, you may or may not remember, and you may or may not kind of able to concentrate on. But hang on a second, or what if you could just have that at your fingertips when that is the right timing for that person, when they're in the right headspace to be able to focus in on it, when they are in the right sort of mood, as it were, to do it. And the point is, I think, for us, it's very much around early intervention, and we do that obviously with the children, but I think even as an adult, once you've come to the realization that this might be an issue for you, just being able to have that early intervention, have those strategies, be able to kind of say, right, okay, I think this is possibly something that's happening to me. I don't know, I haven't got a diagnosis, but what harm are those strategies going to do me? They're not at all. They're just going to help you understand yourself, and they're going to help you to move forward. And so it's one of those sort of no harm can be done. And I think that there is I think to some extent there isn't a focus on the medication, and we try very hard to sort of focus away from that because it's not really our domain. We're primary care. We are able to deliver primary care interventions, and of course Shiny Minds and all the associated life packs really fit nicely with that. So which is why we want to support it moving forward. I will say, and every GP up and down the country at the moment will say, we are being overwhelmed. And there's a lot of failure demand. So that idea that the patient comes in, they are then said, right, okay, well, either you're sitting on a waiting list for 4 years or you can't be referred or whatever. But that problem hasn't gone away for that person. Just because you've told them that they can't have it doesn't mean you've solved what was bothering them in the first place. All you've done is say, we can't help you. And so what tends to happen is that people will come back over and over again, and then to some extent get more and more angry and upset and irritable and frustrated with the fact that they know that there is help out there, they just can't access it. Particularly if they can't afford to go privately, and particularly if they can't afford to pay for coaching, whatever it is, you know, that those things that we know can help. And so I think that it does widen those inequalities in health. I think there is an inherent health inequality with neurodiversity anyway. Just being able to organise yourself to go and do the forms, just be able to even get yourself referred is just don't get me started on the forms. I mean, who gives a group of people with difficult difficulty in executive functioning some of the most complicated forms to fill out to get referral? And I think it's done to reduce the waiting list sometimes. I just find it extraordinary, you know. And I think that this is all part and parcel of saying, you know, look, you know, and like when somebody says to somebody with ADHD, "You'll go and read a book." Well, it's you're talking to somebody who's got problems with executive function. They've got to go and buy the book, they find the book, read the book, find the time to read the book, think about the book. The book might not be the right way they want to learn about symptoms and the way they're doing it. You know, you've got to be able to give them the different ways of being able to find that sense of self in all of this and being able to be able to function in the adult world. But like I say, we do a Let's Talk Neurodiversity series, and we get, of course, you get families of people with neurodiversity. So you quite often will see, you know, this is sort of multi-generational, and the parents are bringing the child in, but they're going, I think that might be me. Pretty sure that's also me. And so you kind of then you're sort of establishing these sort of whole networks of people. So to be able for the parents to learn to be able to help strategize for children is so useful, because it stops that conflict. You know, it's that you're trying all the time to reduce that familial conflict of why can't you remember your pen? And the young person, I don't know, I just don't remember my pen. For whatever reason, I do not remember my pen. Becca and I were talking about it. We think at every school there should just be a pot of pens for all ADHD children, and they can just, well, no questions asked. You can just walk in, pick up a pen, and go to their desk and sit down. Because it's almost sort of pathognomonic, I think, just not having a pen in any of your lessons. But I think that for me, I think that like I said, we have to think of different strategies now to help people sitting on a waiting list, because even then, like you say, you get the diagnosis and then there's no magical moment. You know, it's not just about taking a pill. It's unbelievably more complicated than that. So that's just my views on it, and that's why I want to support this thing. Yeah. If you ever find a way to get an ADHD referral accepted in Hertfordshire, I do, Kevin, and I understand. I feel your pain. Yeah, we're in Hertfordshire.
Yeah. So everybody out in the audience, please do put a comment in LinkedIn, and the comment will feed its way through to us, and then we can try and address anything that comes up. Is now a good time just to pick your brains, Rebecca, on the finances of it? I'm just pretending to be a finance person in the NHS again.
Okay.
So again, picking up on Sian's point, my gut experience of business cases is that every single NHS organisation out there would, if they did a proper business case and they looked at all the failure demand across the entire system, would be able to justify that 95,000 just for their own region, because the failure demand will be huge and the costs associated, it will be huge. Benefits, inland revenue, implications for people, you know, losing work, etc., etc. It will be absolutely colossal. But when you're really struggling with your budget scenarios and you're trying to break even at the year end, 95,000 feels a lot of money and it feels like a big risk. But the whole crowdfunding idea just makes it possible, doesn't it? It makes it completely accessible. You know, if you're putting £1,000 in or £5,000 in, you know, most organisations should be able to manage that, because the upside will be huge. And I've felt it. It feels visceral to me, the upside of doing this properly. So just mechanically then, if I was an organisation putting £5,000, because the big picture will be the upfront build and development and doing it right and making sure it's clinically robust, etc., is where the expense comes from. Once it's built, it's just the maintenance, isn't it? And, you know, there's a new piece of evidence come out, so we'll tweak the app to make sure we're compliant. So there's going to be ongoing costs, but they'll be small compared to the initial investment. And then you've got your general maintenance of making sure the IT works, and you've got all the IT costs and management staff-wise. But that's, I guess, all quite low compared to that initial upfront investment. So given all that background, if I'm an organisation that puts £5,000 in, how does that compare to somebody that puts £1,000 in, and how is that going to be managed, and that ongoing sort of maintenance cost? How will it all work?
So great questions. And if any organisation is sat out there and can actually see the ROI as you've described it, well, then drop us an email. Okay, fill in the form, because we could all start straight away. So we've done the crowdfunding to actually mean that people who've got small amounts of money but want to make a big change, want to make a big difference, like some of the work that Sian's been talking about and at her practice, and Janet, can get involved and actually benefit their patients really quickly, to sort of start that recovery journey. So in terms of the way we've done it, is the crowdfunding is based on you get something for putting something in. And so you get access to the Shiny Mind Wellbeing prescriptions and the various life packs we have, coping with anxiety, mental wellness, menopause. And when we hopefully get the adult neuro pack sorted out, by the end of this year, they'll be able to prescribe that too. So for £1,000, which is your initial, I just want to be involved, you're busy, you don't have to roll your sleeves up and come and do the co-design, because we appreciate not everybody's got the time to do that, but really can see the benefit to actually address what Sian's talking about in the sort of failed demand. And you get 100 wellbeing prescriptions. And so that's at a reduced rate of £10 plus VAT per annum. And if you join us before the 31st of May, then you will lock in that cost for you for your whole journey with us. So every year, if you want to renew, then it's £10. If you want to actually come in at the higher package and actually roll your sleeves up and co-design and really get involved, it's £3.5K. And that gives you access to 500 wellbeing prescriptions. So that's at £7 a prescription for a person to support them for a whole year, to get the kind of support Leslie was talking about. So the ongoing sort of maintenance, etc., is done by Shiny Mind. We're not putting that as a load on to the clinicians we want to work with. We're just saying, just work with us on a per prescription basis if you come and help us make this happen. And the normal price of a prescription is £15. So it's a huge discount to kind of be involved, to make a difference. Hopefully I answered that well enough.
Yeah, really good. I've got another quick one. If anybody, unless I'll let everybody else go first though, but this has just come up, which is a good question.
Who will help IP for the platform? Who will who will hold the IP and who will bear the responsibility for safety and performance? Hold. Thanks, Faruza. We would hold the IP in the same way that we have done as we've co-created other resources, because that enables us to prescribe at scale in lots of different places. And actually, we bear the responsibility for the safety and the performance in terms of the functioning of the platform, and we evaluate it and do all the ROI work. Obviously, we are not in a separate relationship with patients. The patients are being prescribed this by their clinician. So the clinicians are involved in that care pathway in terms of prescribing a digital wellbeing prescription.
Brilliant. I've got a quick question just to follow on, which is still sort of finance related. If a particular NHS group of practices in primary care said, we can't afford it at this point in time, but you've managed to do the crowdfunding and it's up and running and off the ground, would it be possible for, let's say, Leslie, whose area hadn't yet come on board, would Leslie be able to just fund that herself? Because she paid the £10 a year. Because it sounds like that would be a heck of a lot cheaper than the coaches, than the ADHD coaches.
Well, I think we'd have to ask Leslie whether she'd want to. But anyway, when Leslie and I caught up earlier this week, Leslie also had a brilliant idea, because she's full of them. And that was, what about as we go through this, let's say we don't get enough money. I mean, that would be a real sadness that there's not enough, I don't know, people that can't see how this would really benefit their practices or their patients. If we didn't, we could go out to patients and say, we are doing this with NHS clinicians. This could be a trusted resource that we can evidence-base against, and actually get them to involve them in the crowdfunding as well. And they could come and help us design it. Because let's face it, this will only be designed if we have patients with lived experience in the room. It will not be designed by just clinicians. That is not the way that Shiny Mind does work, does co-design work. Leslie, what do you reckon?
Yeah, I mean, I think what's really interesting about this, I've not come across this crowdfunding idea before. So I've worked with hundreds and hundreds of companies, sort of trying to get NHS contracts. And I think this is a new approach where actually what you have to say is it's a system-wide problem. It's a problem across the whole UK, and by developing a resource, I'm sure you've got to look at it not as a regional approach, but it's a UK-wide approach. So if someone's coming in late, I'm sure Beck, you've got your sort of pricing strategies, haven't you, where it sort of levels up. I think probably what you've got is, if you are an early adopter, you've got more influence over the co-design, which is I don't really know an opportunity where you would have this with any other tech, where you could actually influence and sort of work through, particularly if you're a GP or a clinician that you've worked with your patients with ADHD, and you know what they need and what would help you within your work of what the pressure they're putting on you, to be able to design a package that then releases some of that capacity as well. So yeah, I think it's probably taking the risk, if you're early adopters, that you can influence it.
Yeah, really interesting. There's another good question come up. Sorry, there we go. From Farouza again. Medical device question.
Okay, no, it's not a medical device. We've gone through DTAC, so we're DTAC compliant, if I can get my teeth in, but we are not a medical device. Is this available now? Yes, it is helping thousands and thousands of patients already improve their mental health and their low mood, depression and anxiety, and where there is a comorbidity of mental health with a long-term condition, it's helping improve their physical health, and it's also available for workforce as well. Hopefully, Farouza, that answers your question.
Yeah. And just to add a little bit from my perspective on the IP bit, I would say, from my experience of working with Beck, she's trying to do the right thing here. It's not about being a multi-millionaire. It's about having to cover the costs, having to pay the mortgage, but above and beyond that, it's about trying to do the right thing. So that's my feel. Anyway, you might want to add to that, Beck, but that's where I think you're coming from.
Well, absolutely. I mean, we haven't mentioned this on the call, but because of working with the NHS in the sort of like co-design space, we were approached by NHS England and Dame Ruth May to actually build out a nursing and midwifery edition of Shiny Mind, to deal with the attrition rates, to actually have that number of nurses and midwives fit to be able to do the job that they're doing. And so we did that through secondment with NHS England. Karen Story came and worked with us for 2 years to co-design with people, like the same way we're saying here, with the right people in the room to talk about what they need. We built that resource and we gifted it to every single nurse, midwife and healthcare support worker can access Shiny Mind to support their mental health and well-being for free. So yes, we're not in it for the millions. We're in it to make a difference and to do the right thing.
Great. Sorry, I keep double clicking for some reason.
Is that Kevin? Kevin, one of the other life packs that we have been asked to look at, and again, we are looking for supporters, is one that is about a family life pack, which is to do with parenting, but it equally is to help parents who are struggling with children who are not getting access to support in terms of CAMHS waiting lists, where we've seen horrendous stories where families break down and those children who have not got support end up in care. So yes, we are looking to develop a family life pack as well as the adult neurodiversity life pack.
Do you think this life pack could be used for children in the future, or is there a reason why we're only doing it for adults?
We're only doing it for adults at the moment, just because it's a 18+ resource, age from an age group point of view, but we have been asked to support 16 to 18-year-olds. So yes, Sian, I can see it being extended. And interestingly, the sort of like creep into the 16 to 18-year-old sort of space, it's been led by GPs who've actually used it for themselves and said, my kids are struggling. Can I get this for my kids? And we've said, okay, as long as you can go and try it and you can get the feedback and we can work out what needs to change or how to make it like so that it's as good as it humanly possibly can be for a younger age group.
And you know, in the past you've done group consultations, haven't you, Becca? Is there a space for that within this life pack in terms of kind of into groups that could be created for service users to reach out to each other if they wanted to, or if they wanted to share experiences? Or
I think in terms of the group work, again, anybody who doesn't know this part about our journey, is part of the prescribing has led to us doing large-scale group consults with 100+ patients at a time. And they deliver the similar impact to talking therapies, but without a waiting list and in 8 hours. So we apply this, if we can build a family life pack or an adult neuro life pack, then we can actually collect groups together and bring them into that same virtual group space and do the same group consults, but on a specific topic that will really support that. And I think, Sian, that would be incredibly exciting to even consider that we could support people proactively through group and then the content that is there 24/7. Because what resonated for me when you were talking, and I could see Leslie nodding, was sort of like, well, do you want to go and do your therapy now? If you've got the money to go and do it, is today the right day? Whereas actually perhaps you're not in the mood and maybe a better day is tomorrow, or actually a better thing is you've just got support. You've got, as people have often called us, a coach in your pocket. You know, you've got support 24/7. If you're not sleeping, you know, it's there. You're not alone and you're not waiting.
I think the sleeping thing particularly be really useful to a number of people who just get up in the night and they're doom scrolling, so they're stimulating themselves, but what they're actually looking for is something to help them go back to sleep.
Yeah.
And not meditation. I don't know what it is about meditation. Sorry, Janet, I apologize.
No, I was going to say that Beck and I over the years have talked about many different life packs. I know we're here to talk about ADHD, but the fact of the matter is there are so many things about this app that are useful. And my daughter is now 34, but I remember when I first had it, and she was probably early 20s. She came home one day talking about something that had happened to her, and I said, just let's put this on and listen to it. And I think it was the drama triangle, because it's one of those things, once you know, you can't unknow. And she loved it. And over the course of the next 3 or 4 weeks, all of her friends rang me or came round to the house to say, can I listen to that thing that you let Elizabeth listen to, because she's not stopped talking about it. So there are lots of things, there are lots of aspects of the app that are just simply, it is that coach in your pocket that you can seek that advice and listen to at any time. And I think the creativity of the people in the room here, how many of us have had a patient go out of the door and you look at the door thinking, if only I could do this ... for that person, or if only there was ... what if we could? And that's why I think the idea of crowdfunding and bringing different people from different areas together makes such sense for me, and the right people in the room at the right time. And I think it's innovative. And of course, a lot of this, although a lot of it is about treatment and helping people who have a condition. We were talking about the medication earlier. If we think about the 3 big shifts, one of them is from treatment to prevention, and having this earlier is all about preventing our conditions worsening, preventing families fracturing, preventing people leaving, preventing anybody thinking that life is just not going so well for me. It's having that intervention earlier and earlier, because life as we know it now is just complex all the time, and we need to be able to call on that help when we need it and not have to wait. And that's why I think this is such a good idea.
I think the other point is, ADHD or not, you can't absorb all that relevant information in a GP appointment, can you? You only catch a fraction of it. It doesn't matter who you are, I think. So having something to go and review as and when you need it is big, I think. Really big point.
And we're not experts. You know, as GPs, you'll get huge variability. There'll be some GPs who've got a natural interest in it. There'll be others who just go, no, I'm sorry, I just don't know anything about it. And then that's okay, you know. And this reduces that variability. So if you've got, so it doesn't matter what GP you see, you're being exposed to a similar, really robust intervention.
The other thing that we've found by using the app with patients is that 10 minutes is in no way, no one would ever say a 10-minute consultation is adequate for anything that comes through our doors these days. But for something as complex as a mental health condition, absolutely not. What we have found is, and especially with the nudges, is that it extends the consultation. So people can take this information home with them and listen to it, and it's pretty much affirming what whoever has said at the practice. But with the nudges, there's that other aspect of, you're still with me, you do care about me, and it's not just that instant cut off, because we're nudging patients, you know, how's your day going, or have you had time to check out this masterclass today, or whatever it is. There's that, we're invested. And patients know that, and that's a sense of we're all in it together, and it really helps. A lot of patients have said how the nudges really help them.
Something's just come to mind.
Sorry, I was going to pick up on the family life, because Beck and I talked about this. So my middle son, so I've got 3 sons, who was obviously showing signs from an early age. My parenting until my diagnosis was quite emotional dysregulation. It's quite difficult. I think there's anything, and sitting in CAN's waiting rooms with him during his very long diagnosis and titration, which was also very painful, but that's another story. I could see lots of parents that with kids with ADHD, and actually diagnosed loads of parents as well with ADHD while I'm sitting in that waiting room. But the parenting thing, the approach, understanding, this has helped my husband, who's not doesn't have ADHD, be able to parent in a kind way, because my son, one example, always loses his zip card in London, so he can't get to school. 100, like just so many, since the diagnosis and since strategies, what you need to take before you go to school, we don't have that. So the parenting, I can imagine, would be enormously helpful, because if you don't have ADHD, you don't understand that someone's not doing it on purpose. It's like the pen. You're not doing it on purpose. Kids not doing it on purpose, just the way they are. But it's also the family life, because there's 2 of us and then there's another 3 that don't have ADHD. And there's always like, oh, you're always blaming it on the ADHD. But if you've got something that you can say, this is how our brains work, this is the strategies, this is what we want you to do, I'm sure it'll be much more harmonious in families.
Absolutely. I've just had a bit of a brainwave. I've just been working on a business case earlier this week, and a cost has popped into my head. Could be a very, very simple ROI business case, this one. Leslie, when you've been struggling, how many GP appointments in a year would you say you've had?
You see, because I've worked in the NHS, I don't use my GP because I can't. And also, my ADHD I can't hold on to a telephone call for hours on end. But I think probably for other people, it would be an enormous amount of GP appointments you would save. My brother, for example, that does go to the GP, and I'm sure there's lots of his comorbidities are tied into his ADHD, overuses his GP enormously. So I mean, he's also been out of work for 20 years the economic
the
benefits.
cost will be ginormous.
Yeah, please.
But just purely, this week, my brain's not perfect on this. It's either £41 per GP visit or £49 per GP visit on average. That might be the difference between training involvement and such like. But we're over £40, so we basically
also,
only need.
If you were to do an ROI on this, the clear one is if you help people either prior to a diagnosis, they don't need the expensive psychiatrist diagnosis. It is a psychiatrist. They don't need the titration, and then more importantly, they don't need the medication, and the cost of the medication is pretty high. It's quite high. The cost, because the demand's gone up, is pretty expensive. There's a very, very clear ROI on this. You know, you're going to make the saving.
You only need to just reduce your GP visits by 0.25 a year to pay for the license.
And also you need to look at urgent and emergency care. People calling, you know, people with quite chronic ADHD and other mental health disorders, turning up in A&E constantly, turning up, you know, there's a very, I don't know what the statistic is, but the clear link with suicidal ideation is there. Offending, I mean, the economic case are very much there at the moment.
If any finance people are watching this and don't get the feel that this is a strong case, then I think you're in the wrong job.
Or get in touch and help us build the business case.
Yeah, absolutely. So we've got to that end of the hour really, really quickly. So has there anybody got any questions in the audience that they're desperate to ask before we go? I'll just bring this one up quickly whilst we're waiting for any others.
Okay, yes. So Farouza, we've done lots of research around the impact of Shiny Mind before and after 6 to 8 weeks, and then also longitudinally, sort of a year plus. So we've also most recently had all of our data verified and validated by Liverpool John Moores University.
Brilliant. So does anybody want to do a close, or should we leave that to you, Beck?
Well, I would just like to say a big thank you to all of you guys today on the panel for turning up, Anthony for making this happen, for us to tell the story, the bravery and courage that Leslie's shown, and the sort of passion that we see in clinicians like Janet and Sian that want to do the best for patients. I really believe if we want something to change, we've got to be the change that actually makes it happen. If we're going to wait for somebody else to solve this, like Leslie said, there's nothing really out there. We're going to wait a long time. And I think crowdfunding is a way where we go, let's not wait, because none of us are waiting well. Let's start doing, and let's start creating something that is really going to work. And then let's follow the evidence, you know, in terms of evaluate it, because then we will co-create something that's never happened, never been done before, but we'll have a win or learn approach, which means we'll keep winning and learning together. And that means we can go on to do other things like living with pain or the family life pack. There's so much need out there, but I really believe that together we can get this sorted. So please come with us on this journey. Sign up, get involved, roll your sleeves up, and let's see what we can achieve. Thank you.
Absolutely brilliant. There's just a reminder that the link to get in touch is in the event, in the comments in the event. This will be recorded and will be in my profile in the events. It'll be recorded forevermore. I'll also stick it on my YouTube channel as well. Then you'll be able to share it with colleagues and such like, or share the link in my LinkedIn profile, but it'll always be there. Keep the comments coming. And really enjoyed it. Thought it was a brilliant event. Thanks everyone. Really, really good.
Thank you.
Excellent. Thanks a lot. See you soon.